Welcome to our new segment called Patch Pro Chat, where we introduce you to expert wellness professionals who have incorporated the LifeWave patches into their practice.
Learn not only how they use the patches in their practice, but also the innovative and customized modalities they use to ensure their clients get a completely holistic solution to their problems.
The patches are just one tool in their toolbox to help their clients live their best life.
We will have experts in brain health, homeopathy, skincare, chiropractic care, naturopathy, massage therapy, energy work, quantum medicine, and much more.
Thanks for joining us for this episode of Patch Pro Chats. Today I have with me Daniel Flowerdew. Welcome, Daniel.
Thank you, Annie. Thank you. It's a pleasure to be here.
So Daniel is a licensed deep tissue and reflexology massage therapist, intuitive healer, psychic, and weird shit specialist. We're just going to talk about his expertise and his toolkit and how he's incorporated the patches so far in what he does and what he's learnt, and on the focus of pain and trauma today we'll be talking about. So there we go.
For sure.
Let me begin with the disclaimer. So products discussed in this segment are not intended to diagnose, treat, cure, prevent any disease or medical condition. If you are pregnant, nursing, or on any medications or have any other conditions or disease, always first consult with a physician or other qualified healthcare provider before embarking on a new treatment, product use, diet, or fitness program. This presentation is for educational purposes only. So welcome, Daniel.
Thank you.
So I've got some questions here. So tell me a bit about yourself, your expertise, who you serve. We'll start with a bit about yourself, what you do.
Okay. So being a massage therapist has always been a calling of mine. Even when I was a kid, I jokingly tell my clients that I started doing massage when I was 5 years old, because family at gatherings would be wanting me to work on their neck or their back, or I had an uncle that would have all of us kids jumping on his back to try to give him some relief. So massage for me started very young. I've always greatly enjoyed it. To me, massage really works on all different levels, not just the physical. So I love it because when I'm working on people, the way that I put it on my website is each individual is their own song, right? We all have our own notes, undertones, crescendos, decrescendos. We have all these different things going on that we're not even completely aware of ourselves. When we're using any sort of holistic practice, including massage, herbs, the patches, it works on all of those levels all at once because everything is connected. So from my perspective, it's just fun. It's always been what I love to do. I jokingly tell people that I am a damn dirty hippie. I don't know if that word's okay to say or not, but I spend most of my time out in the woods, barefoot, talking with the trees, listening to the birds sing. So that's a little bit about me. I don't have this long hair just because it's fashionable, okay?
It's because you're antenna,
because
right?
I'm a hippie. Oh, yeah, they are antennas, yes. Yep. So a lot of the clients that I work with have normally mental, emotional pain. A lot of them have extreme physical pain. I have a wide range of clients. But one thing is for certain is when a person comes to me for a massage, they don't want a little fluffy, light massage. No, they're coming to me because they want things to be fixed and they want things to be brought back into balance.
Yeah.
So everything from arthritis to carpal tunnel, bulging discs, cerebral palsy. I've had many clients in the past that had sexual traumas where it's hard for them to accept even being touched at all, let alone being on a table under a sheet where someone is over top of you. I've had a lot of clients like that where I help work them into it. I have clients that just need general upkeep, clients that have breathing issues that wanted help with reflexology or cranial sacral to see if it will assist their breathing. Sleeping patterns being off, issues with the digestive system. I had a website recently ask me, what are all the things that you can work on? And I'm like, a little bit of everything. I have yet to find something that I couldn't work with, either as a massager or as a medical intuitive. I have yet to find something that I felt like I needed to say, I can't do this, you need to go somewhere else.
Yeah.
If that happens, I'm more than happy to do it, but it hasn't happened yet. And I've been practicing, since I was maybe 15 years old, massage since 2018. But I've been a medical intuitive since I was about 15 years old. I've been doing this for a long time. And I have yet to find a situation where I had to turn someone away. Except for when they were being creepy. Okay, I've had a couple of those, especially for the massage. We get some creepy people for that. But that's the only reason why I've had to turn anyone away.
Wow. Yeah. That's awkward.
Tell me about it.
So you've covered. So basically, you don't have a typical client who suffers from it, except maybe emotional trauma,
Yes.
and that I've experienced in my own, in the recent years anyway, especially since being on the patches, that if you are in too much physical pain, you can't really go there emotionally, because it's almost like, yep, I'm ready. I can't. If I go there, I'm checking out, so I totally get that. So talk a bit about how, because it would be really good that you are skilled and equipped with emotional and intuitive medical intuition and all that sort of stuff to help people while they're on the table. So do you do much dialogue with your clients depending on if they're comfortable with it?
Yes, if they're comfortable with it, I definitely do. A lot of times I'll even talk with the body while the person's on the table. So let's say they have a shoulder pain and I'm working into that spot. It's like, okay, body, what is going on here? What do you need us to know? And, if I'm really into it and I'm listening, these are skills that all of us have access to. If I'm listening, the body will say what is going on. And so, I will talk with the body. I'll talk with the person too and have dialogue with them. A lot of times during the massage, I let the body do the talking, not so much me. If the client has a lot to say, I'll let them talk. But it's really about listening to what the body has to say during massage. I do so many different things. I have reflexology that I've been trained in, craniosacral, deep tissue, Swedish massage. I've done gua sha. I've done cupping. I do acupressure. I've done so many different things. It's hard for me to put it all into words. But basically, what my practice comes down to is listening to the individual, where they're at right now and what they need at that time. Yeah. Because everyone is different. That is one of the reasons why disclaimers are so important, because one size doesn't fit everyone. So, it's kind of like finding different strokes for different folks. Some people like the percussive work. Some people need very gentle, very smooth movement.
Yeah, so that dovetailed in lovely. So thank you. So, but you mentioned acupressure points. So tell me a bit about what you know about why they're so important in helping bring relief.
Definitely. So I will say that with acupressure, everything that I do know is from working on clients as well as personal research. I don't have any credentials in that per se, right? So another disclaimer then. So with acupressure, there are certain spots in the body. There are three main groups that I always try to work on in any situation on any client. One is at the very base of the foot. It's called K1. It is, all of these spots are good for general pain relief. They're good for getting the energy moving, good for helping to breathe, and really just helping the body to process whatever's going on in the physical reality. So there's K1. My next favorite spot is stomach 36, underneath the knee, and the large intestine 4, right at the. It's so weird doing this on the camera. It's like, which side is which?
I'm like, you pointed out, and I'm like, I already know how that hurts.
Oh, yes, it does. It does. But with all three of those combined, when you have them worked on, they work on your stomach, they work on your respiratory system, and they work on the intestine. So they help your body with really processing reality. A lot of people think of digestive issues as only in the stomach, but a lot of it does have to do with what are you not digesting in your reality. Um,
Wow.
so working on those spots kind of triggers the body into delving deeper into those scenarios, delving deeper into the problem to figure out a better solution or a better perspective to process what's happening in their reality.
Yeah, wow. So are acupressure points, I kind of think them similar to like energy flow, or like
Yeah.
it's symbiotic with our nervous system, as well as, because everything's connected, when
Yeah.
the joke, the head bone's connected to the knee bone. It literally is. So,
It
it's
is.
like everything is connected. So
It is. It is. Yeah. So, acupuncture is definitely like that. Acupressure is definitely like that. Everything is. Massage is. I've recently been studying about herbs and medicinals in that regard. It really is all energy. It's all connected to that flow and finding where the restriction is and helping to get that moving. Which is also another one of the techniques that I have is I do a lot of energy work. I help people get rid of psychic implants. And it does get kind of weird. If people want to know more about what I do have a YouTube channel. I've got a lot of great information online, so feel free to go and check it out. But yeah, timeline soul retrieval work. I've got, I help people get rid of curses and energetic overlays that are messing with them.
wow.
And a lot of times, even working on that will shift. I had a client that had major PTSD to the point where they couldn't leave their house. They were absolutely traumatized. They were basically bedridden. And after a few sessions, we found some things that were messing with them etherically. We took them out, and now they're going out dancing. They're going out
Wow.
shopping. They're having fun in life.
Yeah.
And it's not the first time that's happened. So going back to the acupressure here, yes, it definitely affects the energy system. And the energy system is composed of the body, the mind, and the spirit. So if you work on any of that energy system, it's going to bring balance to all of those areas. Like you said earlier, if a person's in a lot of pain, they're not going to be able to delve into their traumas.
No.
So a lot of times with, let's say someone goes to see a social worker or a trauma specialist, right? The first few sessions is that specialist teaching the client coping mechanisms, because those traumas will affect your body. That's why people like me are important, because we help you to process it and get it out of the body and get you back in control of your trauma instead of your trauma being in control of you.
Well, like what you were highlighting before, you mentioned that the body will tell. So it's almost like we've got it. Society's got it in reverse, where we're looking at the body as like that's the issue, that's the cause, whatever the symptom is. Then we mask it, or we do this, or we do that, and that's allopathic. When actually, in my experience, and I know that you can attest to this, Daniel, that the symptom is actually hinting at something deeper root, which often isn't necessarily a physical cause. It's like screaming, okay, this is the issue, we need to address this here. And 9 times out of 10, it is an emotional or a spiritual issue.
Oh yes, easily. Well, and they are all connected. So, if you're working on the spiritual issue, that is going to affect the mental and physical as well. But yeah, 100%. That is one thing that I have the biggest issue with allopathic medicine, is that a lot of them think the body is just a mechanic, it's just a mechanism, it's dumb, it doesn't know what it's doing. These bodies are highly intelligent, and they listen to what you're saying. So if you're telling your body it's dumb, you need this medication, your body can stop producing certain chemicals that it can naturally do to promote health and well-being. So I do have one more quick thing to talk about with the acupressure. And this is one thing I love about the patches, right? When you are putting the patches on these areas, they are not just sending light signals into that area, which, we'll get into the mechanisms of the patches here soon, for people who are watching this that don't know what they are. But you're also applying a small amount of pressure to that spot. over a long period of time. So you're still getting a little bit of acupressure as well as the other benefits of the patch. So, I tell people to experiment and play around with their patches because you never know what spot is going to call out to you and why. Recently, I was having some wrist pain. Massage therapist, it happens, right?
Oh, yeah.
And I was like, okay, so yeah, exactly. All right, body. So where do you want me to put the patch? And I was told to put it right on this elbow.
Oh, yeah.
And that area is common for digestive issues.
Oh, wow.
So about half an hour after putting that on there, the wrist pain was gone.
Oh,
So
wow.
that was a plus. But, by experimenting with it, I got to learn one more little spot, one more little trick with the body. And this is a spot as well that most people are very, very tight on. If you tell someone to grab their thumb and to go up the forearm, up to that elbow, it gets really tight and tender. And if you can roll back and forth on that area, it can decrease the chance of getting carpal tunnel, but it hurts. It hurts. Like I'm doing it right now, and I'm like trying not to show the squealing, right?
I can feel, both sides, like, ooh, maybe left side less than right side. Yeah.
Yeah. So you're probably right hand dominant.
Yeah, rock hard, mate. Oh.
Yeah, exactly.
But like that particular point is linked in with tennis elbow, the commonly known tennis elbow, and golfer's arm, right? So
yes. Yep.
But you said it linked. It's indicative of something going on with the stomach.
Yes. Yep.
Wow.
Yep. From what I remember, when I looked it up online, it said it had to do with bloating, gas, and indigestion was its main thing. Now, normally when a person has a hard time processing food, it's because of a high level of stress and anxiety running through the nervous system. So if you think about it, all of those spots, they're not just helping the digestive system. When you're working with the body as a whole, you're not just working on this one muscle. You're working on all of the different areas that could be impacting it at that time.
Yeah, wow.
So, I've seen a lot of people use the patches and all of a sudden start singing or dancing. And these are people that have been sad or have had depression. And, all of a sudden they're just feeling a little easier.
Wow.
So,
yeah, that's really cool. Well, so you mentioned the KB, so your three favorite spots.
Yes.
Is it K1 or KB?
K1. Yeah.
K1, sorry. Yeah.
Kidney one.
Yep. Okay. And then the other one below the knee was?
Stomach 36.
Stomach 36. And I choose to remember there was something that you messaged our group about at one point. It was like stomach 36. And we're like, oh my gosh, yeah, that works. I should remember what the issue was that you recommended that for.
Yes. A couple of things. So one thing that I have found, and this is kind of what you were talking about, if I put energy enhancer up on large intestine 4 on each hand, and then put the ice wave on the stomach 36, I tell you what, that'll get you better moving in the morning than a cup of coffee.
Wow. Oh, no way. Okay, awesome. Energy enhancer ice wave. That's so good to know.
Yeah.
I'll be recommending that. And there was another one There was another one that you discovered. I choose to know how you did in terms of your hearing and your hearing loss. Do you want to share about that?
I do. So when Jody first got me introduced to the patches, I was having major hearing issues. I had a ear infection that I've had for 4 years, and I kept it mostly at bay with the work that I do, but I did end up having to go to the hospital to get on antibiotics, and they barely helped. But then once I started using the patches, I started experimenting, being like, okay, well, I want to work on the ears. So body, where should I put it? And I put it on a spot called Triple Burner 16, TV 16.
Yeah.
Yeah. So I could be wrong with the name, but I think it's TB 16.
I'll find it.
I'm self-trained. I know the spot and what it does, but I don't know the names. I'm the same with massage too. I'm like, I know the scalene muscles and the psoas muscles. Besides that, everything else is, I know.
Your hands go where they need to go. Your hands are magnets, right? Yeah.
Exactly. Yeah. I know a lot of the other muscles and their insertions, origin, all that jazz. but there's really only a few that are really important to know. The rest of them, my hands just do their thing.
So you're talking about the acupressure points, right? But with your ears. So
with
what
ears.
So you asked your intuition where to put those, and so your body gave you a signal. So cool. I love that. The body doesn't lie, right? And and so how long was it before you noticed relief?
It really wasn't that long. At that point, I was already on the antibiotics, so the pain was already decreased. So I would say I noticed the most effects somewhere around the 3-week mark after using the patches. It wasn't instant. I did get some instant benefits. As soon as I put them there, my ears did start to drain.
Wow.
They were draining into the ducts as well as out. So that part was weird, but that was pretty instant. I noticed the greatest amount of my hearing returning about 3 weeks later.
Wow.
So I would use different patches here. I'd experiment with them. I would use the Aeon on the right side and the 39 on the left. Or I would do the energy enhancers here, or the glutathione on one side and the Aeon on the other. I kind of experimented to play around with them because, when you're using the patches, it's best to move them around from spot to spot, not to keep them all in the same place every day.
Yeah.
So I don't know which patches worked best for that, but the combination of them, switching them back and forth, it really helped.
Wow.
Now,
that's
the
really cool.
TB17, the Triple Burner 17, is known to help with ear infections. And according to what I've read online, in a lot of the Ayurvedic training, they'll say that ear infections are caused by bad wind getting into the ear. And the Triple Burner helps to heat that up and expel that bad wind.
Wow.
So, yeah.
That's really cool. That's really cool.
It
Well,
is.
Here we go. Let me just see. Well, now that we're starting to talk about the patches, I'll bring them on and we'll talk about patches. So,
yes, please do.
So what is this technology that we're talking about? For those who aren't familiar, is these patches use a process called photobiomodulation. This patch is about the size of a Band-Aid or a 50-cent piece, and the white part is the proprietary technology that looks like a piece of fabric, but it's made up of organic amino acids, sugar, salts, crystals, and oxygen. And so this forms a crystal lattice structure that becomes reflective. And then when we put it on our skin, what happens is our body heat or our low-level infrared light, the part that is not light that we can see except when you're wearing, night vision goggles, is...
reflected back into the body.
Back into the body. Yeah, that's right. And what happens is, like with the X39, it's signals off back by our light back into our body to signal a peptide called GHKCU, which is a copper peptide, which was discovered way back in the 70s, believe it or not, by Dr. Lauren Picard. You can look him up. And this copper peptide produces helps activate our stem cells. And as we age, our stem cells, they dwindle and they get sad and sorry. And so by the time we're 30, 35, we've lost about 50%. And by the time we're 60 to 65, we've lost about 90% of our stem cells, leaving us with only about 8 to 10 stem cells of old aging stem cells to repair our body. And so why are stem cells so important is that they actually are the building block or materials that morph into any cell or tissue that our body needs repairing. So, and a lot of things impede our stem cell activity, like our diet, stress, emotions, injuries, things that are caused by inflammation, toxins, petrochemical exposure, etc. So now we have a way to activate them and bring them back to life.
Yes, and also I have found certain breathing techniques as well that help us to activate our stem cells. The only downside to that is you have to remember to do it multiple times a day, whereas with these patches, you can just put them on and forget about them until your alarm goes off 12 hours later and take them off.
Well, this is the thing with a lot of people that a lot of people who try them or whatever, and they're like, this is great because of our allopathic a programming in our conscious that where it's like, it has to work instantly. If we don't get relief within a couple of hours of putting something on, then it's not working. This is regenerative. So regeneration doesn't occur in an instant. This isn't symptom suppression. This is switching on your body's own intelligent repairs and regeneration mechanisms to repair issues that taking over-the-counter or prescription medicine would not provide. So this and as far as healthcare regimes and programs to incorporate, this is not like anything else where you got to organize your tinctures. There's not this whole big palaver. It's literally just take off the backing and stick it on. Just remember to take it off. You're not going to get any easier than that, and that's still hard for some people. But let me say it this way. If it's not working, it's only a matter of time. It works for everyone. There's no one who's that special where it won't work. That's the thing. If you're drawing breath, even if you're not, I've heard a testimony of a soldier who had a prosthetic limb, was in great pain where his leg used to be, and put a patch on the prosthetic limb and the pain went away. So, it's just a matter of time. It works on anyone. No one's that special where it doesn't work, right? So that's, I'll get off my right.
There are a few of us, though, that are special where we feel it instantly.
Yes.
I know I had that happen where my clarity was all of a sudden just amplified. I felt energized. The first time I did the X39, sorry, I've got to share this real quick.
Go.
The first time I did X39, I put it behind the neck on one of the recommended spots. And so, I had the automatic clarity. I felt energized. I felt great. Pain relief pretty much instantly. The next day, I was like, I want to try the other spot. And this might be a little too much information for some people, but that morning, within 5 minutes of putting the patch underneath my belly button, I went to the bathroom. I probably lost like 5 pounds.
Oh, wow.
It was instant.
Wow.
Instant. And I didn't have to go to the bathroom before I put the patch there. So I am one of the lucky few that I have noticed benefits instantly.
Well, that was the same with me. I put on the energy enhancers for the first time, and I'd had a heart rate was really high. I'd taken my heart medication an hour and a half before, and it had not made a dent. My heart rate was over 140 beats a minute. Maybe down to 135 by that time. And then I put on my energy enhancers on PC6. Do you remember? So that one there, under the 3 fingers underneath the wrist. And
that's either 4 or 6. I think that's 6. I think 4 is further down the arm.
Yeah, okay. 6 or 5 or one of them. Anyway, 3 fingers below the wrist. Yeah. That's where I put them. And my heart rate came down to 85 beats a minute within 10 minutes. And I was like, whoa, what voodoo is this? Nothing had brought my heart rate down. I literally, then it had my attention. I was kind of like, yeah, whatever, these will work. I was a skeptic, right? So I'm full convert now, because I was like, that for me was huge in comparison. The medication I was taking did not have that effect. So yeah, very huge. So I'll just go through this list quickly. So these are some of the benefits that people notice having been on the patches, wearing them consistently, right? Reduction in pain and inflammation, improved mental clarity and brain function, like Daniel alluded to, improved energy and vitality, better sleep, stress reduction, which is crucial because, like we mentioned earlier, with physical pain, you can't go and deal with your emotional pain. Everyone's got emotional baggage, right? Increased muscle mass and bone density, wound healing, improved endurance, age reversal, wrinkle reduction, hair growth, belly fat reduction, hormone support, and there was been so many more benefits that people have noticed with these patches. So we'll go back into a little bit more of your experience, Daniel, with pain and trauma. I'll share my example too about when we worked together as well. So,
that's wonderful.
Yeah. So, but tell me a bit about what your family and friends have noticed with the patches.
Okay, so I'll go through it somewhat quick here while still getting to the good spots here. Sure. So I have one family member that she ended up breaking her foot several years ago, I think about 6 years ago now, where her calcaneus bone was turned to dust. So she now has 3 cadaver bones in her foot, as well as a cadaver nerve running from her knee to her big toe on that same foot. So, granted, this foot is in constant pain. One day we were going to a cousin's wedding, so I gave her an X39 because she wanted to wear heels, and I was like, okay, try this, see if it helps. She wore heels all day and didn't notice until she got back home, and she was like, oh, my feet are only right now getting, that soreness that they would normally get after the first 5 minutes of wearing the heels.
Wow.
So that was an instant benefit. Several weeks later, she was in so much pain she couldn't stand on that foot, and I was like, I just recently won some ice wave as a prize, so let's try it out. Let's try it out on her and see how it goes. Within 10 seconds of putting that on her foot, her pain level went from a level 8 to a level 3.
Wow.
She says it's not been at a 3 since before the injury.
Oh, wow.
So, and we've experimented with it. We'll go, we had her keep that patch on for like 3 or 4 days to see how long it took for the benefits to go away. She was able to feel the patch for 4 days each time that we've done this. Okay?
Wow.
Of course, it wasn't as strong as the first day. It did decrease a little bit, but she was able to feel benefits still up to 4 days.
Yeah, wow.
So a few weeks later, we tried it again. And, we just kind of experimented at random times to see, just see if it was placebo, to see if we were making it up. Every time that we did it, 3 times, every single one of those times, her pain went from a level 8 to a level 3 or lower.
Wow. That's huge.
So, yeah, it's huge. It's huge.
Now, so Ice Wave, they work differently than X39 or whatever. They actually open energy channels.
Yep.
Is that right? And then they also block certain pain receptors at the same time.
Yes. Yep. One of their main benefits is they do increase energy flow. I did have a neighbor that had really bad arthritis in her right knee, I believe. And I did 2 different ice waves there. And because it increased the energy flow, it actually made it hurt more for the first couple of hours because that area was not used to having any energy flow. Now, of course, she didn't tell me this, and she just went off to say how terrible the patches were. And I was like, if you would have told me, we could have worked with them to get rid of the pain, not only the pain that was amplified from the patches, but the pain that was there initially. So, the ice wave is awesome for increasing energy flow.
But that's indicative too, like of the paradigm shift. Like people don't understand, like if things get worse, because I get it. Life's hard, survival mode. You're on the hamster wheel. You just want the pain to go away. But actually, if you give yourself the space and time and allow and go, hang on, my body is doing a thing. Let me just support and trust it instead of trying to whip it into submission.
Yeah.
Taking a different approach, that shift takes time. But again, they'll come away going, oh, those patches didn't work for me. It's like there's a lot that people need to understand about how their bodies work.
Exactly. One of the first things that I learned in massage, this is what one of my teachers told me, is that any change is a good change.
Yes.
If you work on an area and something changes, even if you don't like the change initially, it shows that tissue has the capability of changing. And that is what you want. You don't always, we want it to feel better right away, but that's not always the case. So, I totally agree. Our body is doing something. And I think that she should have noticed, it's like, 5 minutes after putting the patches on, it started to hurt more. They must be doing something. But that's okay. I had another family member that had... it was a pretty major surgery. They had to cut open her stomach from her sternum all the way down to below her belly button. It was a bad surgery. And so, when they were done, they had it all stapled up and glued up. She has this nasty scar in her stomach. But I gave her the X39s while she was in the hospital. And she said that anytime that she remembered to wear them, the pain would decrease instantly.
Yeah.
And her recovery was faster than the doctors thought it would be. The doctors gave it, 4 to 5 weeks, and she was healed up and ready to get the staples out too.
Oh, wow.
Yeah. But she's always been that kind of personality too. So I'm like, is this just you and your body and your body's innate healing abilities? How much of this is the patches? How much of this is you initially? However, one thing she has said is that every night that she wears the X39, that stomach area doesn't hurt.
Wow.
The days that she forgets to wear it and she goes to sleep, it hurts.
Yeah, wow.
She's also extremely fond of the aloe vera patch because of its youthfulness, right? It's a youth-bringing benefits. I gave her one aloe vera patch, and I was like, just try this for a night and see what you think. She woke up the next day, and she's like, oh, my wrinkles are smoother. My skin feels so soft. Okay, I'm
9 out of 10 9 out of 10 people, even me. I don't really, I'm low-key, I don't care so much, but I put it on, and the next day I was like, oh my gosh. Like,
yeah,
what even is this?
It's a weird kind of softness. It's like,
yeah.
Is it my hands that are soft or my face? Or
right? Yeah. Well, I have a friend's husband who was like, he likes to like look after himself, bless him. And he was he put his aloe vera patch. He's like, no, it can't be that good. Like, you know, skeptic, right? Anyway, he put it on the night before, wore it. It's a nighttime patch. It took it off the next day, and so in the morning. And by 2-3 o'clock, when his his afternoon shadow would 5 o'clock shadow, whatever, would start to come in. He was like, even the bristles weren't as coarse and rough. They were really smooth and silky. And he was like, this is so weird. So he was he doesn't go a night without them now.
That is awesome. That is awesome. And I bet his partner loves that.
Yeah. No, he's pretty clean shaven.
Awesome.
Yeah, good
That's
fun.
Awesome.
But back to the pain and the trauma kind of a thing. So I wanted to share, Daniel, my experience with you. I worked with Daniel earlier this year. I was back in April, maybe. Anyway, I had about April.
About April. I don't know, timey-wimey, wibbly-wobbly. It was
that's right. It has been this year. Time is going so fast.
It's this year.
So I've been wearing the patches for a year now, but I'd had this emotional upheaval, so to speak, in the last 9 months or so, and I just couldn't get past it. So I was not eating. It was really causing me a lot of anxiety, a lot of stress. I was not sleeping. I lost a lot of weight, and I'd still wear my patches every day, but I just was just an emotional wreck. And what actually was lying underneath it was a lot of stuff from my childhood that I hadn't processed. And so I worked with Daniel, and he helped me do like a timeline therapy, and that was so patches were one thing. I would not have been able to go there emotionally and deal with that emotional pain if I hadn't had my physical pain of like my physical issues. I was vaccine injured. So I put up with a lot of pain for the last 14 years. And so to have that being repaired and regenerated or whatever, then I was able and brave enough to go, I'll be okay. I can go here and then look after little Annie, and it'll be fine. And so I did a 2-hour session with Daniel. It was maybe 2.5 hours. And I was sleeping again. My appetite came back, and just the peace landed. So there's, we are more complicated than just physical meat suits walking around. There's a lot more going on.
Thank you for sharing that, Annie. Thank you so much for sharing that. I love the timeline therapy work. The thing that I like most about it is not only its effects, but when I do that with a session, I'm literally teaching you step by step how to do it for yourself. So someday you can do it on your own without being dependent on me to guide you through it.
Well, that was the other thing I came away thinking was like, okay, I actually can trust my intuition, that I'm hearing the right signals, because Daniel was just the guide, and I was the first to share whatever I was seeing, and he would verify. So that was really amazing, and a fantastic reminder. It really brought peace to me to remember that I'm not hearing mixed signals. Like, I can trust my intuition, I can trust my gut, and I can trust me.
Yeah, and sometimes I will speak first. Like, one of the steps is the cleanup process, right? After your soul has gathered up all the broken pieces from that memory and it cleans it up, sometimes I'll be like, yeah, and I'm seeing it being cleaned up this way. And 9 out of 10 times the person on the phone with would be like, I was seeing the exact same thing. And and it's always different. Sometimes it's like a washboard. Sometimes it's a bubble bath. Sometimes it's like a sonic shaking. It's different from time to time, but 9 out of 10 times when I tell a client that I'm seeing something, they'll be like, they're seeing it too. So they still get that confirmation, like, wow, okay, there's no way that Daniel picked up on this and I picked up on this. Like,
Exactly,
There's no way that
right?
it's fake. There's no way that we're faking this.
No, there is no way. And we did it over the phone as well. But
Yeah.
this just how powerful it is that if we're not dealing with our trauma from youth or whatever, even if we had good upbringings, there's still things that we see through a certain lens, and it causes an emotional injury. And then PTSD is I think it's more prevalent than people give credit for, because we're told to just swallow and suppress and just soldier on. But I really want to share this incredible testimony here from a woman who was trafficked. And so her testimony, her experience with the patches. Yeah.
Real quick, before we get into that, I do want to say one more thing too.
Yeah.
Is that if a person has psychic implants on them as well, it makes it really hard for the patches to do their work. One implant that most people will recognize is called the trash talkers, right? They're normally an AI-based implant, and sometimes they're sticking to the ears, sometimes they're sticking in the auric field, but they're sitting there just trash talking you, trash talking your neighbor, trash talking your dog, people that you're seeing driving around through town. And you'll be sitting there thinking to yourself, this is not my thought. Why am I feeling this way? That's not how I talk. That's not how I process things. But these trash talkers are beating you down. That is a very common and easy to find psychic implant. And once it's gone, it helps the patches then to do its work a little bit better, because it doesn't have that to contend with.
Yeah,
just
that's
like
a good
eating
point.
healthier or drinking more water. It helps the patches, and it's okay.
Well, then
sorry,
that explains a lot of people I've come across with, like, no, it doesn't work for me. It's like, it's a mentality, a big time, but okay, it's an implant. There you go, good to know.
Yeah.
So it can be removed.
Implants can literally control the nervous system and the thought processes, and so much more. They can even, change a person's likes and dislikes. A person can go from hating dairy and ice cream to craving it and needing it all the time. Laura Lee, the person who taught me about the rocks and the eggs, she has a really funny story about that in one of her videos. So if people want to find it, I suggest it.
Well, we're going to have you back on our wellness superheroes, and we're going to go a bit more into the woo and all the rocks and all the other things.
I would love that. It's always fun talking with you and Jody. You're both just such amazing people. Okay, sorry.
No, that's all good.
So
yes, about the trauma, and this is what I've experienced with mine, and it was not even to the degree that this woman experienced, but this was what she said. When you're a trafficking survivor, your body has gone through so much trauma that when you're out and survived, your body still has internal damage. So I talked to many doctors and took so many different medications to try and heal the damage that has been done. And then she finally found the LifeWave patches, which restored her cells and are a part of frequency healing and medbec technology. And she said that she was not able to heal until she found those patches made her healing so much different. And she does have videos and things that she does on that and sharing her story in more depth. But I just thought that was really huge. And also I can attest to that.
Annie, if you can you get a link to one of her videos and put it in the description below?
Yeah, for sure.
I would love to hear more of her story too. That's a rough thing to have to go through. And I'm glad that she found something that's helping her.
Yeah. Well, no, if you haven't got something looking after your physical pain and trauma, then you can't actually bring it all together and then just cleanse and reset. Yeah.
It's too overwhelming. It's too much.
Yeah, absolutely. So, how to work with Daniel, because he's awesome. We love him. You can connect with him on his website, Flower Power Massage. That's still up and running, yes?
Yes.
And you could book a session with him at heal.me/flower power massage. And if you want to learn more about the patches, subscribe to our YouTube channel. We have videos and guests and more things on it like this all the time. So thank you, Daniel. Is there anything else you wanted to say before we wrap up?
Well, one more quick patching story I have. So I have terrible seasonal allergies. Part of it is because the powers that were don't want me enjoying being outside, because being outside is so healing. I've done tons of timeline and stuff on it, and I always get tremendous benefits. But one night in particular, I was having a hard time breathing, and I decided, I have Ice Wave. It increases energy flow. Let's just stick them right next to the nose. So I put them like right on the cheekbones, right on the inside of the cheekbones next to the nostrils. And it was kind of funky, you know, it was kind of too close to the nostril, but within 5 minutes, my entire sinuses were cleared and I was able to breathe.
Oh, wow.
I was
That's
able to breathe
huge.
all night. Yeah.
That's so
It
good. In
is.
fact,
It
I have,
is.
because Jody, I heard that you did that through
Uh-huh.
Jody, and then I
Uh-huh.
did it when I had my last head cold, and I was like, oh wow, this is huge. But also I found like with the TB17, that was really good for like the neck and throat and the gland stuff that goes on when you've got a sore throat.
Definitely. And I am definitely on the autism spectrum. And one thing that I've noticed is that when I use the energy enhancers behind the ears, it not only increases my energy flow, but it helps to bring me into greater balance and centeredness. So I have less of these spasmodic symptoms that people sometimes associate with autism. So
yeah, wow. Well, I did not have you pegged as that, but
yeah. I look through my childhood and I look at all of these, you know, symptoms and, you know, different levels of what people experience when they're on the autistic spectrum. And I am 100% there. I did not deal with it through medications, though. I dealt with it through understanding energy flow and learning how to take care of what I call my energetic hygiene. That to me has been a lifesaver. So, but yeah, the patches have made a big difference for that too.
I consider myself on the spectrum. I don't know how much, because yeah, it's the same. When I was younger, there were certain things that I just was not movable on, and I'm like, why were you like that, Annie? Anyway, but people who are on the spectrum have amazing intuition, and they have greater knowledge and observe the world through a different lens than most everyone else. So they're among my favorite people on the spectrum. And it's not because I'm on it.
So well. You know, right?
Yeah. So.
Oh man, it does help though. You know, there are studies that show that when a person is on the spectrum, they get along better with other people who are on the spectrum versus people who are more neurotypical. Yeah. We just understand each other better, you know. We're smarter. We can't help it. So.
Classic. That's so good. Well, thank you so much, Daniel, for jumping on and having this chat with me. I appreciate you. And yet, if you want to work with Daniel, I highly recommend it. He is such a sweet soul, and his intuition is off the scale. So he can help.
Thank you.
He can help.
I do have one last finishing word, and this is something that my friend always says: onwards and forwards, and don't let the bastards win. Yippee. No.
Yippee. Screw you, losers. Up yours, losers.
Exactly. That's another great tool too, and I shared that on some of my videos. Yeah, that's a good one.
Yeah, we're not talking about you. We're talking about the powers that be that want to keep us in our limited states. So
yeah, exactly. Thank you again, Annie. This is so much fun. This was amazing. And whenever you and Jody want me on the show, let me know, and I will be there.
We wanted to feature you to our patching crew anyway, so that they knew who you were and your expertise, because it's brilliant. I love those spots. Amazing. Okay, awesome.
I appreciate that. Thank you, Annie.
No worries. So thanks for watching. We appreciate you joining us, and we hope that this has been worthy of your time and that you've learned something and had a bit of a laugh. So until next time, we'll see you soon.
Ta-ta for now.